first trimester is the foundation of your entire pregnancy. This is when your baby's brain, the heart, and other vital organs are forming. But any single mistake you make within these first 12 weeks is capable of causing harm to your baby's health for life. There is something called teratogenic effect. A teratogen is anything you are exposed to or you take when you're pregnant that is capable of causing abnormalities to the baby in your uterus. And this can be anything from medications to certain kinds of chemicals to even some kinds of infections you experience while you are pregnant. So in today's video, we'll uncover 10 most important things you need to avoid in your first trimester based on trusted medical advice from both the US and the UK, so you can protect yourself and your little one from the very first start. I will equally be talking about certain kinds of drugs and chemicals that is capable of giving your baby some form of abnormality even when they are still in the womb. Also, I will talk about the simple, inexpensive test that you can use to find out if your baby has any form of abnormality even before they are born, and the best time you can do this test so you can get a very reliable result. Stay with me. Hello everyone, welcome back to Good Life Medics on YouTube, where we discuss everything reproductive health, from fertility tips to all things women's wellness. It doesn't matter whether you're in the United States or United Kingdom, Africa, or anywhere else, the science is clear. Today we're uncovering the 10 must avoid lists for the first trimester of your pregnancy. Stay with me until the end, because mistake number 9 is something most expectant mothers overlook, yet it could make all the difference. Just like this video, subscribe, and let's get started. The first thing on the avoid list might surprise you. It is alcohol. Both the CDC in the United States and the NHS in the UK is clear on this. There is no safe amount of alcohol during pregnancy. Even a very small amount could cause serious complications for yourself and your baby, from miscarriage to even fetal alcoholic syndrome. Fetal alcoholic syndrome is a very severe abnormality that occurs in a child whose mother was exposed to alcohol as at the time she was pregnant. Taking alcohol while pregnant could cause the child to experience so many forms of disabilities, including behavioral disabilities, thinking disability, learning inabilities, including problems with physical development, both taking longer to sit, taking longer to talk, taking longer to walk, and so many other forms of disabilities. And the worst part of this is that this condition cannot be treated. The symptoms can only be managed. They are actually lifelong. So whether you are trying to conceive or you are pregnant already, say no to alcohol, because there is no safe limit at all. The second one is just as dangerous as the first one I already mentioned: smoking, including secondhand smoking. Secondhand smoking is also known as passive smoking. Passive smoking is that smoke you inhale as a non-smoker when you are in the same space with someone that is smoking, and this is actually very bad for you as a pregnant woman. It can reduce oxygen supply to your baby, also raises their risk of low birth weight as well as premature delivery, and even some kinds of birth defects. Okay, it is equally a known cause of sudden infant death syndrome. And some of the harmful chemicals contained in cigarettes, including nicotine and the carbon monoxide it emits, is very dangerous for you as a pregnant woman. Therefore, as a pregnant mother, protect yourself and your little one. No smoking at all, and avoid all sorts of cigarette smokes, both in your homes and in your cars. Also, tell your visitors not to smoke in and around your homes. Equally, avoid areas that people smoke in order to protect your unborn child. Number 3. Now, this one might be a little bit tough. I understand that taking coffees and teas has become part of your morning routine. But when you're pregnant, the rate at which caffeine is cleared from your body is reduced. That is why you have to limit the rate at which you take this caffeine. Caffeine is a major constituent of coffee and is a stimulant that is found in most teas, cola nuts, soft drinks, especially energy drinks, and some kinds of medications. And caffeine has been linked to so many cases of miscarriage, low birth weight, as well as growth restriction. But unlike alcohol and smoking that does not have a safe limit, the good news here is that taking coffee has a safe limit. About 200 grams per day is a safe limit for a pregnant woman. Taking way above that is not good for you and your baby's health. So 200 milligram is just like a simple cup of coffee. Okay, please don't go above this so that it doesn't cross the placenta as your baby is not yet grown enough to metabolize this just yet. Number 4, this one hides right inside of your diet: risky foods. Please, as a pregnant woman, avoid undercooked or poorly cooked meat. The WHO and other public health agencies strongly warns against this. That is because it poses a risk of containing some kinds of microorganisms, including Listeria, Salmonella, Toxoplasmosis, E. coli, coupled with the fact that pregnancy comes with reduced immunity. Pregnant women are more likely to suffer foodborne diseases than their non-pregnant counterparts. Instead, ensure you cook your meat properly and adequately. Instead of eating half-boiled egg, ensure you cook your egg properly so that it kills off any form of harmful microorganism there that is capable of causing problems or complications for both you and your baby. All these microorganisms have been linked to stillbirth, miscarriage, low birth weight, as well as other forms of birth defects, and that is not what we want. Some of these poorly cooked foods can contain toxins that is capable of affecting your baby's brain once they cross the placenta. Eat safe fishes. Not every kind of fish is safe in pregnancy, like high mercury fishes like shark, swordfish. Avoid daily meat, unpasteurized cheese. If you want to eat fish, eat safe fishes that contain healthy fats, such as salmon, cod. Okay, avoid pate, sushi, swordfish, and all the rest of them. As a pregnant woman, just form the habit of reading through the labels of every food you want to consume. Look at it. How many milligrams of caffeine does it have? What kind of fish is this? What is this oil? Just form the habit of reading through the labels. That way you avoid certain things that are just in your plates. Number 5, let's now move to your medicine cabinet. In the US and even in the UK, the guidelines are clear. Not all medicines are safe during pregnancy. Even a simple painkiller like ibuprofen could pose a health risk for you when you're pregnant. Certain acne medication and even some herbal remedies could pose a potential risk for yourself and your baby once you're pregnant. Always consult your healthcare provider before taking any medicine, whether your GP, your OB-GYN, or your midwife. Don't assume because it is an over-the-counter medicine that it means safe. No. Always consult your healthcare provider. Even a simple cold. Don't just take medication. You're pregnant, you're thinking for 2 or 3. So always consult your healthcare provider before taking any form of medication. I'll also tell you certain kind of medications you would take that can discolor your baby's teeth and all the rest of them. Remember at first I talked about teratogens. That is why it is very necessary to carry along your pregnancy with your healthcare provider so you don't make some lifelong mistakes. Number 6, now this is about physical activity. Yes, it is good to keep being physically active while you're pregnant, but avoid strenuous exercises, anything that has to do with heavy lifting, any form of strenuous exercise that could carry the risk of falling or injury is not for you as a pregnant woman. No heavy lifting, no strenuous exercises, no horse riding while you're pregnant. Certain kinds of safe exercises are taking some little walks, yoga, swimming, little mind stretches. That is what you need. And please endeavor to always speak with your healthcare provider before engaging in any exercise so that he will certify you fit before you start. Number 7, you need to watch out for toxins. Certain household cleaners with strong fumes or odor is totally unsafe for use during pregnancy, including pesticides and insecticides. If you have need to fleet your home or your environment or your farm, please get your partner or someone to do that for you. Ensure proper ventilation and only come into that room only when you're very sure the smell is gone or very much breastfeeded, all right? And if you have to handle any form of harsh cleaning agent, please endeavor to wear gloves so that you do not have direct contact of your skin with that chemical. And as for some certain beauty products, please, once you're pregnant, always endeavor to read through labels. There are certain creams or products that are clearly written not to be used by pregnant and breastfeeding mothers. Avoid such products. Pregnancy is just for a short while, and you go back to your products. Pregnancy comes along with stretching of the skin. There's a particular product you're going to use, and with that natural stretching of the skin that comes with it, it will make your skin more prone to stretch marks that ordinarily you may not have had, assuming you were using more natural or mild products. Okay, so forget about the hyperpigmentations that accompany pregnancy. They are all normal. Once you're done giving birth and probably breastfeeding, you have your way of cleaning, safe, natural ways of cleaning that as well. So for now, focus on protecting yourself and your unborn baby so that you give birth to your young one in the best, perfect way you desire. All right. So number 9 is stress. Stress is like the invisible risk. Chronic exposure to stress. Once you always stress, I understand that sometimes stress can be unavoidable, but please always form the habit of taking breaks. Take some rest. And if you feel overwhelmed, please practice some deep breathing exercises. Do you know that deep breathing exercise can as well help you during labor and ease off the pains of contraction? Yes, it can also help you not to push until your midwife says so. There's a way you will be in pains, you're feeling like pushing, but your midwife knows that your baby's head hasn't properly effaced, or maybe it's not yet 10 cm. There's a way you'll be practicing deep breathing exercise. It will help you easing off the contraction until you're asked to. Let me know in the comment section if you want me to talk about this deep breathing exercise for labor, at the point of delivery, and I'll answer it. So always work on your stress level, because stress hormone cortisol, once it's continuously on the rise, it's going to affect your baby's growth and even your health as well. So enjoy calming activities such as reading, meditation, prayers, and please join pregnancy support groups if you truly feel overwhelmed. Right, number 9, I know you truly waited for this. I told you that this is something that some women overlook, especially mothers that have given birth before, but it could be a lifesaver. It could change a whole lot of things for you. So please don't overlook it, both as a first timer and as a non-first timer. Never overlook it. What am I talking about? Never skip your antenatal appointment. I'm going to tell you why I am emphasizing on this. Okay, a friend of mine never knew that her glucose level was very high until during one of her antenatal appointments, that it was discovered that her glucose level was so high to the extent that her baby was beginning to get so overweight. So the pregnancy was managed till she was around 36 to 37 weeks, and she was induced and she gave birth. This is something that she wouldn't have noticed if she wasn't being religious with her antenatal appointments. And please, when you do, ensure you and endeavor that you check out your vital signs and you do those preliminary tests that you're supposed to do each time you visit, including your glucose level, that is your random glucose level, and then your urinalysis test. It has a way of saying a whole lot about the progress of your pregnancy. That is when your protein levels are going to be monitored, your sugar level is going to be monitored, and high your blood pressure level is going to be monitored as well. So never skip an antenatal appointment. It saves a whole lot. I also know of someone else that never knew that her blood pressure was really, really high. 190 over. And this was only discovered during one of her antenatal appointments. And she was admitted. Drugs were infused on her to help arrest the rising blood pressure, and the pregnancy was salvaged. This is something that if you had sat back in your house, because sometimes they don't always come with symptoms until you get tested, and these are just vital signs. Okay, so stick religiously to your antenatal appointments. Don't assume it's all about renewing your drugs, and after all, you still have drugs, or that you know the right drugs to buy. please always go for your antenatal appointment for proper checks. All right. And lastly, please avoid self-diagnosis. Pregnancy is a very delicate condition, and you're nurturing a little human being inside of you. You need to make your healthcare provider your best friend. Stop over googling every symptom. They could cause you stress and anxiety. Okay, make them only source of information and awareness, and not a source of treatment and diagnosis. When you watch some of these online contents, watch our videos, they should serve as information purposes only and shouldn't replace your healthcare provider, especially in delicate conditions like your pregnancy and your overall health in general. Every information you gather here, it will help you when you're in your doctor's office. You like, I had this, I had that. What you have to say, say, okay, this is this, that is it. So it helps you. They are clearly for information purposes only. Avoid self-diagnosis. I already said earlier, avoid self-medication, and your pregnancy is already progressing well. We all are waiting for the good news. Then I said I was going to mention some medications that could cause danger for your baby even while they are still in the womb. And when you give birth to them, some of all these harms start manifesting. An example of such drug is tetracycline. Tetracycline is a drug that is very safe for use for the appropriate age groups. But as a pregnant mom, when you take tetracycline, it's capable of discoloring your baby's teeth. Yes, the teeth are not yet out, but trust me, once you take tetracycline as a pregnant mother, your baby is going to be having discolored. You see all these babies that have brownish, blackish teeth. Most of them were caused because their mothers took tetracycline while still in the womb. Then I said I was going to talk about the simple, inexpensive test that can help to discover if the child you're carrying in your uterus has any form of abnormality that could affect their health or their development, so that you and your doctor can take the best decision for yourself and your child. This test is called an anomaly scan, or a mid-pregnancy scan, or a 20-week pregnancy scan. This scan checks for 11 different conditions which your baby might have, including the spinal bifida I talked about in the part 1 of this video, that is usually caused as a result of folate deficiency. You know, folic acid, as little as it is very powerful. It does a whole lot for a pregnant mother, especially in the first month of pregnancy. That was why I stated that it is very necessary for you to even start this folic acid once when you are still planning for your pregnancy, or right immediately you discover that you're pregnant, because the importance is cannot be overemphasized. Okay, so this scan will help you to assess your baby, including cleft palate. If you know about that, it looks at so many of all these conditions and gives you the best choice to make, both for yourself and your baby. Okay, so with that, we have come to the end of this video. Thank you so much for sticking with me up to this point. Please give this video a like. I really want that your like. It helps the video to be pushed to more audience and will continue growing. And please subscribe if you haven't. Turn on the notification bell so that you always get notified anytime we make any upload. And feel free to share this video to anyone you think might need it, your friends and family or anyone. And if you've got questions, with all pleasure, I'm going to answer them. Just drop them in the comments. I am waiting to hear from you, and I will see you in my next video. Thank you for watching.